Hey. Welcome to Back to School in Good Health. This program is brought to you by Northern Westchester Hospital, Cohen Children's Hospital, and Phelps Hospital, all part of Northwell Health. I'm your moderator for tonight. My name is Amy Rosenfeld, and I'm the Community Outreach Program Manager for Northern Westchester Hospital's Community Health Team. I should also add that I am also a parent of two little boys who are 5 and 2, so I can relate to all families listening to this program right now. With me, I have 3 panelists: Dr. Lauren Adler, pediatrician and lead physician at Northwell Health Physician Partners, Westchester Health. Welcome, Dr. Adler. Dr. Sydney Ivker, pediatrician and lead physician at Northwell Health Physician Partners, Westchester Health. Welcome, Dr. Ivker.
Thank
and
you.
Dr. Vera Foyer, Northwell Health's Associate Vice President of School Mental Health, Director of Pediatric Emergency Psychiatry and Behavioral Health Urgent Care at Cohen Children's Medical Center, and Associate Professor of Psychiatry at Zucker School of Medicine at Hofstra. Welcome to our panelists. Thank you for being here. Today, this dynamic panel of pediatricians is going to discuss how to start the school year off right, on the right foot, with a healthy routine. Topics that will be discussed tonight are recommendations for sleep, overall health, food choices, exercise, mental well-being, and of course, a little bit about COVID and the COVID vaccine. So first, a little bit of business. As time permits, we'll take questions from the chat or the Q&A function, wherever you feel most comfortable. We will address as many pre-submitted questions as we can, and there were a lot of them from registration. If at any time during the presentation you are interested in booking an appointment with any of our physicians, you can private message us, or at the end, there will also be a brief survey that pops up on your screen automatically. Please, we ask for your feedback to fill out the questions in the survey, but also you can put your contact information in there and one of our schedulers will reach out to you. This program is being recorded and the Zoom link will be available and emailed to you tomorrow to share with others or to watch again and reference. And lastly, presentation will have some interactive components using Zoom polls. We ask that you participate so that we can play along, have a little fun, and see where you are as an audience. So let's get started. To start our conversation, we'll touch on general health and wellness questions. So we'll start with you, Dr. Ivker, and to get things going, we're going to start our first poll. So you'll see the Zoom box pop up on your screen. For those of you listening in, true or false, many students carry backpack loads weighing more than 15% of their body weight. What does everybody think? And true or false, prolonged use of screens does not have an impact on children's eye fatigue, focus, flexibility, or eye irritation. So this is a 2-part poll. Let's see what everybody has to say. All right, let's see. Okay, so Dr. Ivker, 100% of our audience says that backpack loads do weigh more than 15% of the children's bodies, and 100% of our audience says false, that children do not, that screens does not have an impact.
So let's start with the first thing. Backpacks should not weigh more than 20% of your child's body weight. And why do we say that? The backpack, in the way that it's positioned on your body, tends to, the heavier it is, pull a kid forward. So that instead of standing up straight, you lean forward, which causes issues related to back strain, neck strain, and also, more importantly, safety issues. Because as you're being pulled forward, a child has a greater tendency to fall. And as we know, kids do not like to tie shoes. So it's certainly another way for them to increase the risk of being hurt. We also need to look at how's the backpack constructed. And while it's really great to have something with a great cartoon character on it or some logo that's special to your child, look at the side straps. Look at the width of the straps. Are they padded? Is there something that can help stabilize the movement of the bag at the waist level as well? And what's in the backpack? Are there things that can be carried in their hands ahead of them instead of on their backs.
Great. And what about the prolonged use of screens? Does it have an impact on their eye fatigue, focus, flexibility, or eye irritation?
Our pediatric eye doctor colleagues are reporting this to us a lot more frequently than they did before the pandemic hit, because we see that our children are spending more and more time on their screens, whether it be for school or social media, their phones, their Xboxes and other computer games. We also know that there's eye strain with the lighting and with the ability to track fast moving objects, especially in video games as well. This eye strain also makes it harder for kids to settle down during the day and settle down at night, which we'll talk about much later. In addition to that, we also need to look at how close does your child sit to the screen? How close do they sit to their TV? Those things as well will impact on eye strain and fatigue.
Very interesting. Thank you. Dr. Adler, we're going to do a Zoom poll before your next question here as well about exercise. Let's see. So exercise question. Children ages 6 to 17 need 30 minutes of moderate, vigorous physical activity twice per week. True or false? I have a little bit more of a split audience here with this one. Let's see what everybody says. All right, go. Give everyone another second. Okay, Dr. Adler, what is the answer?
Well, I think this was a little bit of a tricky one because 30 minutes does seem like a lot, and a lot of you did choose 30 minutes, but actually the recommendation is an hour or more of physical activity for school-age children. And that should include aerobic exercise that gets your heart rate up, in addition to also include weight-bearing exercises, such as jumping and running, which are good for your bone growth. And also muscle building exercise, things that do pushing and pulling. So push-ups, tree climbing, monkey bars, things like that. So it's really important to incorporate all different kinds of exercise for our kids. Little kids, just put them out on the playground for an hour and they get all of that. Our older children may need more structured exercise with the sports that they play. They also all have gym in school, although my children who go to Greeley are telling me that they're doing scavenger hunts. I'm not really sure. I think just getting them to move around at all is better than sitting at the desk. So exercise is so important, not just for our children's physical health, but for their mental health as well. And research has shown that exercise helps decrease anxiety, decrease depression. Anyone on the call who is an avid runner knows that feeling that you get after you go for a nice long run. So it's true that our bodies secrete, mood building, mood boosting hormones and chemicals when we exercise. So it's really good for our overall health. But just a few more things that I want to say about exercise. It's really important to do the exercise, and it's also really important to make sure our children are stretching afterwards. So many people hop in, they do the exercise and don't take the time to stretch after. And that really can lead to injury, fatigue. The more you stretch, the more better your body is able to get back into exercise the next time and get stronger and stronger. And also, it's important for our children now who were really sedentary last year, for us to be cognizant of that. They might have been like a great athlete 2 years ago, and they just sat on the couch for a year, and they might have had some deconditioning. So I think it's important for us to allow our children to have some kind of build up time and really work their way into the level that they used to be at.
Such great information and such an empathetic point. Thank you. Dr. Adler, next question is also for you. Along the lines of studying and homework, it's now 5 o'clock, it's homework time for many. How can I support my child to have good studying and homework habits?
So I think it's important to make sure that they have an efficient and effective study space. So for some children, that might be at the kitchen table in the midst of everything that's going around with their other children. But for other children, it might be really more quiet space in their bedroom. So I think it's important to know your child, know what kind of studier they are, know what kind of environment they need, and how much help they're going to need from you. So some children need you to sit right next to them. Other children don't need you at all. Their space should be comfortable. They really should not be lying in their bed like this or sitting on the floor like this, but really at a desk with, if they're using a computer, with their computer screen at eye level, or sitting at a table with their feet on the floor where they can have their papers, you know, on the desk in front of them. That's really important. I also think giving your children some either time for a little bit of downtime after school, a snack so they're not too hungry, make sure they're well hydrated because they get off the bus, so many of them are nauseous and headachy. So really making sure they're well prepped physically to sit down and do the work is important. And I think also helping your child avoid procrastination. So many children really need help sort of taking the big picture of what they have to do, and it seems very overwhelming, and narrowing it down into chunks. So I think especially for some of the middle school children, it can be helpful to look at what they have to do, help them create a to-do list. So this is all the work I have to do tonight. This is going to take me 15 minutes, 20 minutes, and really working through that with them and taking big assignments and chunking it down into smaller assignments and helping them figure out, I'm going to do this, and then I'm going to take a break. And I'm going to do this, and then I'm going to take a break is important too.
Excellent. Thank you. Dr. Foyer, next question is for you. What can you do if you feel your child is having attention or learning issues? Very good segue from this last question.
Yes.
And if you have concerns about developmental delays for the younger children.
Yeah, so a little bit different question for different age groups. It's relevant. So I'll take the first one first. So along with the things that Dr. Adler is recommending for kids that particularly have a hard time focusing and staying on task with their work, you know, again, just piggybacking what was said earlier about physical exercise, I think it's especially important to let those kids, you know, also move around and exercise maybe before getting to start with the work, because that can really help their brains be able to refocus and function better. But if we're really concerned that kids are really having a hard time sustaining their attention and sustaining their focus, difficulty concentrating on the work, you know, really, I recommend that parents first reach out to the school to see how the child's doing in the school environment. Because for the diagnosis of ADHD, kids, by definition, typically struggle in multiple environments. So it's not just that at home it's difficult, that it is also difficult at school or at grandma's or at another environment with different factors influencing the child. And if across settings they continue to have difficulty, then the recommendation is to get an assessment done to see if there is an issue. That's typically done by mental health providers of various kinds. And it typically does involve rating scales received from the school teachers and from the school setting, as well as filled out by the parents, as well as by the child themselves. And then of course, a clinical assessment integrating all the information that's available. But I really do think that it's most important in the very beginning to start with school and find out what is going on there and request some information from the teachers. And then for the developmental disabilities, you start with my wonderful colleagues, pediatricians, because really those kids should be presenting much earlier. Really important to identify and recognize these delays early on, because with kids that do have delays, early intervention and having them receive the services that will help them develop their skills and sort of maximize their potential is really crucial. So it's a very time-sensitive issue. So really, as early as you have those concerns, or if you have other children and you have now this child and you're not sure, doesn't seem like they're progressing the same way, or you've read and they don't seem to be meeting those developmental milestones that they're supposed to be meeting, definitely speak with your pediatrician about your concerns, because then they can assess and direct you accordingly, and really important to do that early as possible.
Thank you. And Dr. Foyer, along the same lines, if you feel you need support as a parent, because you know what you're talking about can be really overwhelming, or any issues really can be overwhelming, where can you turn for help as a parent?
Yeah, so many different places to turn to help as a parent, depending on what's going on, whether it's parenting help and guidance you need, or whether it's your own mental health support that you need, which we often do, especially in these last 20 months. I think all of our, reserves were kept out a little bit in terms of how much stress we all handled. So really depends on what, but again, if it is parenting advice, the pediatrician or the school psychologist, school counselor, they're all a great place to start to get some initial guidance. And then of course, mental health providers, they do provide parenting support and parenting groups, as well as, support for the parent themselves. So I do encourage people to reach out. There's also, during the pandemic, if the stress and the difficulty is specifically pandemic related, there has been a lot of resources developed by in New York that are free to the public, and they include emotional support hotlines that people can call to get a counselor on the phone, get immediate support, or get connected with more resources. And I can, put in the chat some of that information for those resource lines.
That would be excellent. Thank you. So now the hot topic, COVID. Dr. Adler, how is COVID-19 affecting the pediatric population at this time?
I'm going to take a deep breath for the COVID talk. So we all know that children can get COVID, just like adults can get infected with COVID. Children get infected as well. In the United States, there have been over 5 million pediatric cases of COVID, which represents about 15% of all the COVID cases. Children most often are mildly symptomatic or asymptomatic, which makes it a little bit tricky. I'm sure, most of you or all of you who have children in the school system have come across the situation where your child sneezes in school, coughs in school, complains once of a sore throat or a headache, and they're sent home and they can't go back without a COVID test. And the reason for that is because the symptoms of COVID in children can be very mild. And it's really important to do widespread testing, because that's really how we're going to identify cases and keep them out of the schools to keep other people from becoming infected. So it really is important. Young babies and children with underlying medical illnesses are more likely than other older healthy children to have more serious illness. There are some cases, some children who develop COVID who go on to develop something called MISC, M-I-S-C, which is multi-system inflammatory syndrome in children. And those are really the most severe cases. These children end up in the hospital, and unfortunately, some of those cases do lead to mortality. I had some information. So the part of the confusion with COVID and understanding what's really happening is not every state is reporting their data. And so it makes understanding what's happening in the country as a whole difficult. But just some idea of how widespread COVID is in children. Of the states that reported hospitalizations in children, there were 24 states and New York City. And only 0.1 to 2% of pediatric cases of COVID result in hospitalization. So that goes to show the fact that most children are, again, mildly or asymptomatic. And 45 states and New York City reported pediatric deaths with COVID. And fortunately, only 0 to 0.03% of pediatric COVID cases resulted in death. Thank God. Mm-hmm. But one pediatric death is really too many. Right? I think we'd all agree that that's just too much. So we'll talk about it a little bit, but that's why vaccination is really so important. And again, testing, because if you have one case and you can isolate that person, we're not going to spread the disease in our schools. And just also, I also found it, looked up, in Newcastle, as of September 19th, there were only 37 active cases in all of Newcastle. So that's more than we were maybe in May, June, because with Delta, we definitely have seen an increase, but the numbers here locally still are not that bad, thankfully.
Thank you for that really good summary of information. Dr. Ipker, so now talking a little bit about prevention. The CDC has recommended that all students and teachers and staff be masked this school year. What is your opinion on children wearing masks and face shields?
I'm stuck on the slogan, mask up, vax up, because I think that the two go hand in hand. And the CDC recommends, and we fully endorse across the board as pediatricians, the children 2 and up should be masked. We know that our patients that are less than 12 are not eligible for the vaccine yet. And as Dr. Adler spoke, we also know that some of the infection is mild to inapparent. And while somebody may be asymptomatic, they might still be spreading that COVID virus to others. When masking is not a personal choice, masking is a rule. And it's a rule just like we tell our children, look both ways when you cross the street, wash your hands before you eat. We want to enforce that and explain why. And as parents and as older siblings, we become the role models. So if we're wearing a mask, we demonstrate to our children the importance of doing so. And it becomes a part of what you do every day. You put your mask on, you go to school, you come home, you take your mask off. But there are certain gray areas or areas where we need to look a little bit differently. So if a child has a significant developmental delay, they might not be able to wear a mask. They might be able to wear a face shield, or they might not be able to wear anything. And that's where the school and your pediatrician need to work very closely together to understand limitations and to develop accommodations as would be needed. As we look further into masking up and mask breaks and what's involved in the school setting, we also have to look at physical activity, our sports and our team sports especially, and when is a mask appropriate for sports. Outdoor sports, in looking at the New York State guidelines, do not require masks if the participants are spaced apart. So while they might be playing on the field, they don't need to wear their mask, but certainly sitting on the bench, waiting for their turn outside of the lacrosse game or soccer game, those players do need to be masked up. We also need to look at the use of masks for indoor sports. So for example, wrestling is very close, and those participants need to wear a mask for their sporting event.
Thank you. So now, Dr. Foyer, I'd love for you to weigh in here. Do masks have an impact on education or social development?
Yeah, I think it's a very common question to get. And I do think parents often wonder about what is the impact of kids having to wear masks. I think kids actually, when it's presented to them and they understand it and the adults model for them on how to behave in a responsible, safe way, they actually follow suit quite easily. And they're very good about masking, and they're very good about following the rules. And it is the exception, not the rule, that a child would struggle with the mask. Now, there's many times that adults around them have difficulty with masking themselves. And I think then, when you're not modeling, or that child is in an environment where different habits are modeled, then children follow that. And then they might report themselves to have a difficulty with masking. But the reality is, in terms of tolerating the mask itself, kids typically don't have a hard time. And even kids that do have difficulty with it can be taught. The example I always give is that, for example, kids on the autism spectrum often have sensory difficulties and love to get naked. And as soon as they enter the home, they get naked. Yet we teach them and train them and have them accept that out in society, you have to wear your clothes, even though you don't like it. But we have different tools in our therapeutic toolkit to teach kids to really learn to tolerate the things that is difficult for them. And in this case, that is really, really important to do so with even those kids who struggle, because it's the best way to protect them and it's the best way to protect everybody in their environment. Now, as far as concerns about kids seeing masked faces all day long, and and how does that impact them? I do think we still don't live in a life where kids see that all day long. They do see faces. They see faces at home. They see faces on the street. They see faces of the people that they're masked together with during the time that they eat, or maybe they're more distant or outside. So it's not that they're not having that experience of learning. So I really don't feel that there's, any evidence to say that there's a significant impact in how this affects the kids' development or learning or any of that. I hope that's helpful. I do know it's a very common question.
Thank you. And Dr. Foyer, back to you also. What can families with unvaccinated children do to reduce the risk of infection?
I might defer back to my pediatric colleagues on that because they may know better the answer, but certainly, other than, the vaccination, masking, social distancing, hand washing practices, all the things we did before the vaccine came around are all the things that we need to continue to do. And again, modeling for kids, really having them understand why it's important in terms of mitigating the impact of stress and trauma of the pandemic on kids. It's important for them to know that they actually have a part in keeping themselves safe, and the mask and all these other strategies are a part of that. And that can make kids actually feel better and less anxious and more empowered if they understand what their role in all of this is.
That's such a nice way to think about it. It's really a great perspective. Now, Dr. Ipker, you're going to get the real hot topic question. All parents saw this week that vaccination might be coming out for 5 to 11-year-olds. What's the latest update?
The latest update from today actually is that there will possibly be the availability of the vaccine around Halloween. And the dosing will be different than that of the adult patients, parents, or children 12 and up. And that information in and of itself, the dosing being different, is important because we have parents and we understand that there's a push. You want to move on. You want your child to be vaccinated, but we don't recommend, we don't suggest, nor would we endorse trying to get your 11-and-a-half-year-old a dose of the vaccine at the dosage rate for a 12-year-old. That there are studies that have been done, both here and abroad, that have come up with the appropriate dosing for children of certain ages. It's going to be 2 vaccines as best we understand right now. And our hope, certainly through Northwell Health, is to have pods set up within the region to allow parents to come with their children, to schedule an appointment, to have their vaccines done in a vaccine pod, similar to what we all did as adults and our children 12 and up.
Great, thank you. That's a really, really good summary and reminder for everybody about where they would be getting their vaccination for their children. Now, Dr. Adler, you don't get off that easily. Do you and will you recommend the vaccine for your patients under 12 and currently for over 12? And does it impact other vaccination schedules?
That is the question that everyone's asking. I do very highly recommend the COVID vaccine. I currently recommend it for my patients 12 and up, and I will without hesitation recommend it for my patients 12 and under. I myself have 3 children, 2 of whom are eligible for the vaccine and have already received it. And I have a 10-year-old who is waiting with bated breath for his vaccine, which he knows he will get ASAP. So I really do recommend the vaccine. As I mentioned before, and as Dr. Ifker mentioned and Dr. Foyer, masking, social distancing, testing, and vaccination above and beyond the other 3 things are really how we're going to get ourselves out of this pandemic. You know, we talk about the Delta variant, which has become so prevalent here and is really causing a surge in cases. And the fact is, the more people we have that are vaccinated, the less places the virus has to go, thus people the virus is able to infect, and that will decrease the creation of different variants. So it's so important for so many reasons for people to get vaccinated. I know everyone is so afraid of the vaccine because it's new and nobody likes to sign up for to be first in line for new things unless it's a new iPhone. But with new medical treatments and medications, people are hesitant, and I completely understand that. But it's important for us to realize a couple of things. mRNA vaccine, it's new and being used, but mRNA vaccines and technology have been studied for 10 to 20 years. mRNA technology is used in other treatments, cancer treatments, and other places than just the vaccine. And it's been shown to be safe. There really is no worry, no scientific worry that it's going to affect our DNA, alter our DNA in any way. That just is not biologically plausible. It doesn't work that way. And there have been, and when we talk about studies and everyone's concerned that the process was rushed through the FDA, it hasn't been out long enough, think about the sheer number of people, of doses that have been given over the past almost a year now. So now we have almost a year of data, and 386 million doses given in the United States, and over almost 6 billion doses given worldwide. So no, it might not have been studied for 10 to 15 years, but the sheer amount of patients that we have that have had received the vaccine, again, for almost a year now, if you count the studies, it's astronomical. It's really not a small number of people. So I think that is reassuring. And we have ongoing, the VAERS system, I can't think of the word right now, but ongoing regulation and monitoring side effects and things like that continue to go. And no vaccine is without side effect. The COVID vaccine has side effects, most commonly fever, sore arm, redness, fatigue, chills, body aches. Those are the most common symptoms that we see both in children and adults. People are very concerned about myocarditis in young adolescent boys, and that has happened. And there have only been about 1,500 cases of myocarditis that have been reported with the vaccine. The majority of all of those patients have recovered. There have been no deaths from that. And the majority recovered really without much intervention. We also know that COVID-19 infection can cause myocarditis. That's part of that MISC syndrome that I mentioned earlier. Those patients are hospitalized and have died from it. So the risk of getting myocarditis from COVID far outweighs the risk of getting myocarditis from the vaccine. Another side effect that we commonly see that people are very worried about is anaphylaxis. And the vaccine is not recommended for people who are allergic to polyethylene glycol. That is a very rare allergy. Most people do not have it. So the vast majority of people are safe to get the COVID vaccine. And I know on the internet, there's a lot of noise about fertility issues in young girls. And again, there's just, there's really no study that has shown it. That has not been really, oh my gosh, what's the word?
Valid.
Thank you. That's not the word though. It hasn't been reported to the VAERS.
There you go.
And from a biological scientific standpoint, it's just not plausible really for these vaccines to affect fertility. So again, I highly recommend the vaccine. The CDC and the American Academy of Pediatrics have changed their tune. It is safe to give the COVID vaccine with any other vaccine. So it's okay to get your flu shot on Monday and your COVID vaccine on Tuesday, get your Gardasil shot, within 2 weeks of your COVID vaccine. Really, just like all the other vaccines that we administer regularly in our offices together, it's safe to use the COVID vaccine in that way as well.
That's great to know. Also, it doesn't impact your child's vaccination schedule in any way, shape, or form. Really great summary. Thank you. I think we've all had enough COVID talk for a little while. Let's transition into sleep. Dr. Ipker, we're going to have a little fun with the audience for a minute and launch another poll, see what they feel about sleep. True or false, children ages 6 to 13 need 9 to 11 hours of sleep per night, and 13 to 18-year-olds need 8 to 10 hours of sleep per night. True or false, audience? Let's see what you think. All right. Got a little variation here. Let's see what everybody says. So majority says true. Dr. Ipker, what's the answer?
You're pretty correct. So sleep is important. Why is sleep important? As a parent, sleep is important because it allows you as a parent to have some downtime as well. But let's just look at sleep overall. Sleep is important because if you sleep well, the next day is a good day. A good sleep will improve your child's attention span, their behavior, and their ability to learn. We know that not sleeping well can cause anxiety, an increase in blood pressure, obesity, and depression. And why does that happen? Because if you don't sleep well the night before, the next day you're tired and your child comes home and takes a nap. What happens at the nap time? The nap disrupts the ability to fall asleep later in the evening. It limits your child from doing their sports or just moving around. It increases their stress level because now they've slept for 2 hours in the afternoon and now their homework isn't done and they're up later and later. And not just on a school level, but we see it in our younger children as well. The toddler that comes home from nursery school who misses his or her nap is now having tantrums and outbursts in the afternoon because they're overtired and overstimulated, and they haven't had time to kind of wind their brain down. Sleep numbers vary amongst ages, and we know that the 3 to 6-year-olds sleep about 10 to 12 hours a day and usually go to sleep between 7 and 9 o'clock at night. Most 3-year-olds will nap, but by the age of 5, it's expected that they won't nap. Our 7 to 10-year-olds will average about 9 hours of sleep a night, and our 12 to 18-year-olds will sleep about 8 to 9 hours a night. But again, we look back at sleep hygiene and what makes sleep healthy. You need to create a routine before bedtime, especially for your younger children. It could be the bath, the reading of a particular book in a special chair before bedtime in a room that is darkened or dimmed, the same song being sung. And it sets a routine and it decreases the falling asleep anticipation behavior that can sometimes be a little bit unnerving for a child. I suggest that in children that are having school anxiety and transitioning in the morning, that you rehearse the day the night before. Lay out your child's clothes with them. Talk about you're going to wake up in the morning and what would you like for breakfast? And then you're going to go on the bus, you'll go to school, and at the end of the day, you'll come home on the bus or somebody will be picking you up or you have this activity, just so that they can plan that out in their head the night before so that there's less fear of, oh, well, I'm getting up, I got to rush off to school and I don't know what's going to happen. Make sure that your child has a snack sometime before bedtime, but not so that they're so full, but that they're not hungry, because when they're well fed and comfortable, sleep is also much easier to sustain and your child has a better sleep health. The other thing is look at what your child's doing the day before. Encourage an activity. We've talked about the importance of sports and moving around. The more active your child is during the day, the better they're going to fall asleep at night. And talk to your child. Sometimes the quietness or just the insulation in their bedroom before bed is a great opportunity for your child to open up to you and to talk about something that might have been bothering them all day, the week before, or something that they're worried about that might be coming up. And it really creates a nice one-to-one conversation and a sense of a team in approaching concerns or issues that might come up the next day or in the future.
Such tangible advice. I can apply many of those to my own household. Thank you. Okay, Dr. Adler, a topic that's near and dear to my heart, food and nutrition.
Food is also near and dear to my heart, sorry.
Great. For a busy kid with a full schedule, how can you get your child to eat well in and out of school?
So as with so many other things that we do, wearing masks, exercising, getting sleep, I think modeling good eating habits and good behavior around food is one of the best ways to get our children, I'm sorry, I'm on call, my phone. One of the best ways to get our children to eat healthy. So eat healthy yourself, and hopefully your children will follow suit. I think it's also important to make the healthy foods and snacks as accessible as the unhealthy snacks. So very often it's so easy to open the cabinet and pull out a cookie and you have a snack, but maybe having something healthier is not as easy, which is why I always try to have pre-cut up crudité or little pepper slices, carrots, cucumbers already set up and out on the countertop when my kids come home from school or an activity. Makes it easy to grab. Sometimes they'll eat it plain. Sometimes you can have some hummus or some dip with it, but have it out there ready for them to grab. Cut up fruit, the same thing. So have the big bowl of grapes out on the table so that they can just grab that easily. It makes it less tempting to go into the cabinet and grab something that's unhealthy. I also think that, so those are ways to get healthy snacks, healthy meals. I think it's important to meal prep. I think that having your children involved in the process really does help them foster healthy behaviors, help them want to eat healthy foods. So asking your children, if you have 2 or 3 children, you can ask them, what do you want for dinner? And they can each pick a night to pick a healthy meal that's acceptable for everybody, and involve them in the process, involve them in going to the supermarket, picking out the healthy produce and vegetables and proteins. And then on Sundays, you can all gather together in the kitchen and prep a few meals ahead of time together. It involves them in the process. It's an activity to do, particularly in the winter when we're not outside so much, or during a pandemic when we're not going places. We can all cook together and talk about what's healthy and why we're cooking this food together. And then if you already have that prepped 2 or 3 meals on a Sunday, it makes it far easier on Monday night when everyone's exhausted to just pull out the healthy food and heat it up, and you already have a dinner set up there for you. The same thing for lunches. So if your child's not buying lunch at school and you're sending lunch, set those up at night so you have time to put some thought into it and create something healthy together.
Those are such great ideas. I love that, creating an activity around it and divvying up the work. So it's not only on the adults in the households. It's lovely. And just similarly, in your opinion, Dr. Adler, how important is breakfast, and how can, especially with older teenagers, how can you get your child to physically eat in the morning, even some young kids?
That is often hard, but breakfast is important, especially for our children who are growing and expending a lot of energy. They really do need a calorie source in the morning to give them energy to get through the day and start their day off right. It is unfortunate for some of the older kids who have lunch scheduled at 10 a.m. to have breakfast, but it's still important to try. And I think similar to my ideas for dinner, I think having easy meals for breakfast makes it easier to get breakfast into them. So things that are quick and easy. A couple of things that I like to do are egg sandwiches. And I have two suggestions for egg sandwiches. So one is making breakfast burritos. So like a whole grain tortilla with scrambled eggs, maybe some spinach and cheese. You can make those on your Sunday nights and put a whole bunch of them in the freezer. And then you could just take them out, pop them in the microwave, and they're heated up and ready to go. And they could take that on the bus. Well, they can't eat on the bus anymore because they're masked, but they can eat at the bus stop. That's a really easy thing to do. We also make our own version of Egg McMuffins in our house. So if you take a bowl with a microwave safe bowl, 2 egg whites, the spinach goes on top and the cheese goes on top of that and acts like a cover. And you put that into the microwave for a minute, the whole thing gets solidified like an Egg McMuffin, and you just put it on the toasted English muffin. It's delicious, it's healthy, it's not high in calories or fat, and it's fast and easy. So I'm a big fan of the egg sandwich. Other things to get healthy breakfast that are quick and easy, making overnight oats. So you can set that up the night before, it's ready to go in the morning. A quick piece of whole grain toast with some peanut butter on it is a healthy, easy breakfast for kids to grab and go. Avoiding high carb, high fat, high sugar foods is really important. So other things that might seem easy, but are really not that great for giving your child energy are store-bought muffins, sugary cereal, plain bagels, Eggos. Those are all really easy, but not quite as healthy, and they're not going to sustain your child for as many hours at school.
Great ideas. I'm ready to make some eggs. Thank you. And now, Dr. Foyer, we want to get to our last section and talk about mental well-being for our kids. How can parents help their children develop good self-care routines and manage normal levels of stress and anxiety?
Yeah, so it's a great and very important question. I think we actually spoke about and covered some of the aspects, because I think all these healthy habits that we're talking about with regards to sleep and nutrition and movement, they are certainly all part of managing stress. But really, when we're talking about helping kids manage stress and manage difficult times in their life, I think 5 basic principles are important to mention and are easy to remember and to follow. And they are, first of all, safety. Kids really need to feel safe, to feel well. Our sense of safety as a society and as humans has been shaken like never before in the past 20 months. And I think, when adults are feeling unsafe, the kids pick up on that. Again, the same thing. What we model, how we behave, how we manage our stress is what the kids are going to learn and see to replicate. And so it is really important to help kids reestablish a sense of safety and a sense of some sort of control. And we talked earlier about how actually wearing masks is a part of that, or washing hands, or talking about what are the family's sort of habits, or what are the things that you as a family do to stay safe and stay well and together. And then really hearing kids out and letting them talk about what their concerns are. Just really starting with what they feel is going on. If they're worried, if they, let's say, kids that haven't been in the school building, and now this September is the first time they're going back, and maybe they haven't been in the school building because they have a chronic condition and everybody felt it was safer for them to do virtual learning last year. Now they're coming back to the environment with their chronic condition. It's important to hear them out, to hear what their concerns are, because you will quickly learn that kids sometimes have an accurate idea of what is going on or what the risks are and what the dangers are, and sometimes they don't. And it's really important to start with what they understand about the situations, and so much misinformation going on in our world, of course. So really important to level set with your kids, find out what is on their mind, what are they concerned about, gently correct misinformation, and then reassure them and reinforce what are some of the things that we're doing to keep safe. Number 2 is calming. And calming is a really big bucket because so much what we've talked about now can fall under calming, but calming doesn't necessarily mean you're going to be sitting and meditating and breathing with your child, although those are great and yoga is great and all these things are wonderful, but some people don't like that and don't do that. And some kids definitely don't want to do that. For them, calming might be playing tag or soccer or a hide and seek or a game or, coming up with what shape the clouds are when we're staring at them, or playing games of guessing tastes with closed eyes of our food. Because all of these activities really allow us to be mindful and to focus in the moment, to put away our stresses, to give our brains a break. And really, that is the point of mindfulness. Mindfulness is not about being still. It's not about being, not moving. It's really about being able to stay in the moment and really not have your mind wonder about what happened in the past and what's going to happen in the future, because those are the things that sort of create and climb that anxiety. So if you're able to stay with fun activities with your kids in the moment, that will really help them be able to calm. And then third is self-efficacy. During the pandemic, we've all been asked to do things in different ways that we've ever before did. And kids oftentimes now returning to the school environment, especially with some of the learning loss that had happened last year and some of the difficulty that kids were having with virtual learning, might now in September really feel sort of like, can I really do this? Can I come back in the school building? Am I still able to navigate all of this? And it's really important to remind them of their own strength, of their own resilience, and really what is it in their toolkit that they can use to help navigate problems, and do something that we talked about before with the getting to school, collaborative problem solving, preparing for the day. Let's talk through it. What do you think will be difficult? What do you think will be hard? And I know that you are always very brave, or you always do this, or you're always, able to do that. And so I know that you're going to be able to navigate this difficult situation, because kids need to feel self-efficient. They need to feel their own power. And that is a really important part of their resilience. And then the last two things, the fourth thing is connection. Connection really got so impacted through COVID, and really helping kids reestablish connections in a safe way with people in their life. Very important in terms of them managing stress. And last but not least, hope for the future, and the understanding that, some of these things are difficult, but we've already overcome so much together as a family, as a town, as a society, as a state, as a country. And we, have learned so much during this time, and that's going to help us navigate whatever comes next.
Such a positive, uplifting message. Thank you. And in case somebody is really worried about their child, I'm going to launch this poll here just to talk about some symptoms of stress to be aware of. Let's see, which of the following are symptoms of stress in children? Check all that apply. Avoidance of favorite activities, irritability or anger, behavioral issues in school, feeling sick, such as frequent headaches or belly aches, or all of the above. Let's give the audience just a second to answer. All right, let's see. Okay, so what's the answer? Majority said all of the above.
They're right.
A smart audience.
The majority is right. It's all of the above. I think that's important to note, and it's a great question, that kids and adults, but kids even more so, stress can manifest in many, many ways, and anxiety can manifest in many, many ways. And oftentimes it does manifest either in physical symptoms, which, we can talk more about with our pediatric colleagues. I'm sure they see that plenty. And then it can also come with behavioral issues. Somebody who's anxious and really stressed can present, we talked earlier about ADHD and concentration difficulties, kids with stress can easily look like they're having attention concentration difficulties or aggressive behaviors or oppositional behaviors. The younger the child, the more likely that their anxiety and stress will manifest either in somatic complaints or in behavioral problems. So it really runs the gamut.
Excellent. And I know you put a lot of resources in the chat for parents who might be struggling. Do those resources also cover if they feel their child is having mental health concerns as well?
Yes,
Excellent.
they can call that support hotline, get connected to resources. Yes.
Excellent. So I see we have some pre-submitted questions in the 4 minutes we have remaining. And we had one question also come through in the Q&A. Dr. Foyer, I think this is a good question for you. Recommendations for screen time allowances. I like the word allowances with that.
Yeah. So screen time in our kids' digital lives probably requires an entire evening to its own because it's a big, big topic. And, I'm sure Dr. Adler, Dr. Ifter also has a lot to say about it. But certainly a big and very important area for parents to be educated about, to understand more about, and to really learn to monitor and learn about their kids' online lives the same way they know and learn about their real life lives. Because the same way that you wouldn't just let your child go to just anybody's house and be exposed to anything over there, you shouldn't do that on the internet either. And you especially shouldn't do that on the internet, because the internet, just so that everybody knows, let's say about, and I might be slightly off with my numbers, but about 5 to 10% of the internet is the open internet. That's what Google can reach. That's what you can search for when you're putting in something in your browser. But really, the bulk of the information located on the internet is in parts of the internet called the deep web or the dark web. And they're different things. The deep web is legal usually, and it's things that are usually accessible through some special permitting. So you have to register, you have to have a login information. Our own health system website is part of that. You have to have any company's website, you have to have login information to get into that. And then there's the dark web, which is usually where all the illegal activity occurs, lots of exploitation of children, lots of things that you really don't want your child exposed to. And the difficulty is when you're giving kids unsupervised time on devices, you don't know where they're going. Because of course, people who want to exploit children are very, very smart and are very savvy in getting into programs and into things that can then lure children into other parts of the internet. So really, I guess that is my first part of the answer is that you really do have to be more knowledgeable about what your kids are doing when they're on their devices and what they're using it for. Now, of course, technology now is being used for a million things, which is another reason why it's very difficult to simply answer the allowance time with just one number, because kids do communication and connection with friends, with family members on devices. They do most of their homework. Now, even kids as young as, second, third, fourth grade gets through the pandemic, got used to submitting things electronically and using devices to read, to do different educational things. And then there's, of course, use for recreational activity, which can be watching things, playing things, or interacting with others on social media. And they're all very, very different from one another. So really, one important distinction that I make, it's really not necessarily just the amount of time that kids spend, but also what are they spending their time with, and how much are parents aware of that, and how much are they participating in that. Because there's a big difference between, for example, having your child teach you a game that they've learned and engaging with them that way and sitting down and playing with them, while you then through that engagement start having other conversations that are important that you maybe otherwise won't have your child. That's very different technology time from when they're alone in their room with the lights out and just staring at a device for hours and hours and hours, exploring content of dubious, value, very, very different. So really depends on the quality, depends on how it's used, depends on what is being done. And even with all of that, there needs to be limits, because we mentioned just staring at screens on its own as a concern for our eyes and for our brains, for our sleep. You know, these are all concerns and impact our kids. And then, you know, everything else that they might be exposed to. And, you know, the studies are just coming out about really how serious and deep the impact of specifically social media is on teens. Specifically, teen girls are at highest risk by being impacted by that. And the age is getting younger and younger and younger. And so again, technology is really a double-edged sword. It's part of our life. We have to acknowledge it. We have to know about it. We have to talk about it. We have to prepare our kids to use it safely, and we have to limit access. And I know I didn't give an answer to how much time you should give, because it really depends on the age of your child. The original recommendation before the pandemic from the American Academy of Pediatrics is now being revised, because everybody recognizes that since the pandemic, it's not realistic. But the original recommendation was nothing before age 2, except for video chatting with family. And then above age 2, you guys keep me honest, half an hour, something like that, right? For the older kids. And
that's good to interesting to know that's being revised given current lifestyles and current you know, way of living with technology. But this was such a dynamic and an interesting panel, and I want to thank each of you for participating. We couldn't get to every question in the chat, in the pre-submitted questions. There were lots of questions about nutrition and picky eating, and please know that we are hoping to do another program about this. So please look out for when we do a program more about pediatric nutrition. Thank you so much, everybody, for joining us tonight. You will see a survey, a very brief survey, pop up on your screen automatically when the webinar is completed. Please fill it out. And again, if you're interested in being contacted, in scheduling an appointment, or if your question wasn't answered, please submit it there and we'll be happy to get back to you. The program recording link will be sent to everybody who registered tomorrow, so you will have that. And thank you, everyone. Have a wonderful evening.
Thank you.
Thank you.